You're watching Fox 45 Morning News Weekends.
Well, we all know prostate cancer is a very serious topic. Now, listen to this. 1 in 6 men will be diagnosed with the disease during their lifetime. That's something to think about. But it can be detected early. Here with me today, Dr. Thomas Smyth from Chesapeake Urology with some advances in diagnosing the treatment. Yes, there are some advances as we speak, and that's going to help people save lives. Welcome, Doctor. Thanks for coming in.
Nice to be here.
It's an important topic. We know, especially men, we're told all along about that colonoscopy, but now what are the inroads being made?
Well, so the issues for prostate cancer are that 1 in 6 men will be diagnosed with prostate cancer over the course of their life. We're all living longer. Our big challenge has always been to be able to see inside of the prostate. About 20 to 25 years ago, transrectal ultrasound was first developed to allow for us to see the prostate better and do biopsies. This new advance takes that to another level and really helps us take a look inside much better and more accurately.
Is this available now everywhere? So if a doctor says, you hear 50 years old, you better get that colonoscopy. With this new procedure, is it readily available throughout the state?
So it's not readily available. We actually have the 4th machine of its kind in the country from a company called Coelis in France. There are other companies also that have this technology. And what the technology does is that it combines 3-dimensional MRI superimposed on top of a 3-dimensional ultrasound, which allows more targeted biopsies of the prostate for better detection. The big challenge is there's a space now in prostate cancer. In men if men are diagnosed and they get a PSA and they're diagnosed, they have active surveillance or they have radical treatment, radiation therapy or surgery. This new device is going to help us, number one, better detect so that men with active surveillance can be very comfortable staying on active surveillance, or they can choose treatment. And hopefully in the next 3 to 5 years, this new diagnostic tool will ramp up into focal therapy of the prostate so that we don't have to treat the whole thing. We can just treat the cancer that's present.
So that is the major benefit, along with many others, of saving lives.
Yeah, no doubt about it. I mean, right now the benefit is in diagnosis, and through our partners at Advanced Radiology, we purchased this technology, them for their MRI machines and us for the ultrasound and the software to allow us to more accurately detect these cancers and determine which are really real and clinically significant and need to be treated, and which are insignificant and don't need to be treated.
And how about the risks?
So the risks involved in this procedure are no different than the risks involved in transrectal ultrasound with 2-dimensional capability. The risks are a 1 to 3% risk of any significant bleeding after the procedure and a 2 to 4% risk of any significant infection. So there's really no change. We do these procedures all with men sedated like a colonoscopy, and that way they're much more comfortable. Traditional 2D ultrasound is often done with patients awake, and almost all the men that I've done this on, and we've done about 150 cases, all the men that I've done this on, when I tell them, oh, you'll be asleep because this takes a little bit longer, they say, thank you very much, doctor.
Yeah.
We really appreciate
I know
that.
with colonoscopy, I'll tell you, it was much more comfortable than getting a root canal, so I'm sure this procedure.
Exactly.
Anyone in particular in the male population that would be most likely to seek this?
Yeah, I think the two groups that it can absolutely benefit starting now are men who are currently diagnosed with prostate cancer and are doing active surveillance, meaning they've chosen to not do treatment because it appears as though the cancer isn't big enough or aggressive enough to need treatment. That's number one. Number two, the second group are men who have had this elevated PSA test and they've had multiple biopsies and the PSA keeps rising, and try our best to really find it. We have a hard time finding it. I think this technology would either, in some of our patients we've found it where we couldn't find it before, and in other patients when it's negative, we've actually been able to give them even better reassurance that they don't have a clinically significant cancer.
Well, this is fantastic news, great inroads being made, and we have some more information. Thanks for coming by. If you want more info on the new 3D ultrasound or MRI fusion biopsy, head to our website, foxbaltimore.com/newslinks.